more minutes to allow people to join us for this interesting webinar. So please stay tuned. As people keep joining, as usual, and those who have already participated in all our education series, we will show you a map, and please let us know where you're joining us from. So go to the menti.com page, use the code that appears on the screen, or use your scanner to scan the QR code. And please let us know where you are joining us from. It's always great to see the map populating with different countries from different regions. So please go ahead, use the menti.com webpage and enter the code and tell us where you're joining us from. I'll do the same.
I will do the same too.
Great. We can see you're joining us from different places. North America, Central America, South America, Africa, East, South, Central, Europe, Middle East, India, Pakistan. Thank you so much for joining us today. And we will have a very, very exciting topic to discuss today. So welcome everyone to today's meeting. Today we will be talking about coordination, and in a few minutes we will introduce our guest speaker. In the meantime, I would like to mention that today's meeting will be facilitated by myself and along with my colleague Anabela Sanchez and other colleagues who will be supporting the Q&A session. We will be facilitating this discussion today. So before we start, I would like my colleague Anabela to introduce herself. Please go ahead, Anabela.
Good morning, good afternoon, everyone. Thank you for joining us. I am Anabela Sanchez. I am based in Guatemala, and I have been working as technical advisor for many years, supporting countries, strengthening their supply chain management for pharmaceutical and other commodities supply chain. So very happy to be with you once again.
Thank you, Anabela. And I'm Nora Quesada. I'm a senior technical advisor at JSI. I've been working in international development and supply chain strengthening for many years in different regions of the world, Africa, Asia, and Latin America. And I've been supporting the BHA capacity building project funded by USAID. And we have a very special guest today, Edith Muturi, who will introduce herself. Edith, please go ahead.
Good morning, good afternoon, everybody. My name is Edith Muturi from Relief International, Yemen. I am currently speaking from Nairobi, Kenya, but regularly work from Yemen. I have been working in humanitarian projects for over 8 years in different countries, supporting health and nutrition programming, which includes medical supply chain. And it's my pleasure to be here this time and to share with you the experiences we have had in the field. Thank you for the opportunity.
Thank you, Edith, and welcome again. And thank you for accepting to be part of this education series, which is the last of the year. And we will be closing this education series with a very great topic, which is coordination. So we really appreciate you're here with us. And now I pass the floor to Annabella, who will give us some housekeeping announcement and an introduction to the topic. So back to you, Annabella. Thank you.
Thank you, Nora. And as always, we will appreciate that you start introducing yourself, writing your name and organization in the chat box. And when the Q&A starts, we will really appreciate that you post any comment or question for our conversation in the Q&A button as well. We are going to also do some Menti polls as we have done in our past sessions. Thanks for the USAID Bureau for Humanitarian Assistance. We have been holding this education series and other activities that support building the capacity of organizations working in humanitarian and disaster settings. Some of the objectives, one of the main one is to develop up-to-date curriculum and conduct blended learning courses. And we know that some of you today have been taking that course, including Edith, who is our guest speaker today. We also share learnings through developing case studies and learning briefs that tell what practices have been effective in your organization so that we continue nurturing a community of practice among ourselves. And we also support partners to institutionalize, based on their knowledge, better practices to improve supply chain management for health supplies. As Nora mentioned, we are closing today the education series. We conducted a total of 6 events. And the good news is that at the end of the year, we are going to congratulate those of you who attended 4 or more sessions, and you will receive a certificate. We will be contacting you personally in the next weeks. And also, as the 2023 year begins, we are also going to share the education series part 2. So stay tuned. So we're going to start with the session objectives. First, we will review, with the help of Edith, the benefits of coordination to improve specifically the availability of pharmaceuticals and other health supplies when disasters and crisis situations arise. We know that COVID-19 has been one of the latest, more difficult pandemics and situations that we all have experienced in the world. So we are going to focus a little bit on that topic and how to coordinate in the middle of such difficult situations. We also are going to share experiences from the field. Edith will be sharing a few examples to understand the enabling factors, those key aspects that make coordination more effective to secure the availability of the commodities that you distribute. And last, through those examples, we're going to learn how coordination can lead to tangible results, meaning to make sure that the population that we're serving receive the commodities that they need. Coordination through the humanitarian response is, it doesn't happen if we don't plan for coordinating and for communicating. So we are going to have another Menti poll. So please get ready, and we are going to answer together this question. Please mention one or two benefits of coordination as it relates more concretely to improving first, supply chain management activities, and more importantly, the availability of health products. So please, we invite you to participate in this question as well, using the same Menti code that you used for the map. And I'm going to respond as well. Please let us know if you have any difficulties. I don't see the.
Yeah, Annabella, it doesn't give the option to respond.
Really?
At least I don't get it.
Oh, let me see in the chat. The Menti is not ready. Oh.
Okay, maybe we can move on.
Yeah. Oh, we apologize for that. We're going to continue then, and hopefully the next question can happen. So you can respond in the chat. Since Menti is not working, please go ahead and answer in the chat any one or two benefits that you have really experienced that have been key from coordinating in your countries. So we invite you to do that instead, okay? So we are going to move on, and coordination is a very important word, and sometimes you will agree with me, sometimes so hard to really make it happen, because as you see in the screen, it takes several aspects that we need to purposely promote. And for example, there is a need for transparency and for communication. When people are together, this is essential for really sharing what are the common challenges, what are the common problems. And if we get together and put on the table what are our needs, what are the solutions, what has been successful for us. And so that really is the key for coordination to happen, particularly for this webinar on how to better deliver commodities to the last mile. So we are going to continue, and I'm going to pass the microphone back to Nora. Thank you, Nora.
Thank you, Annabella. So before we hear from the expert in this area, I would like to see if we can answer the next Menti question, which is related to when do you think in which of the areas of functions of the humanitarian assistance of the supply chain in particular, it is more effective and beneficial to coordinate. Maybe even if you don't see the question on the screen, if you can put your answers in the chat so that we know when you think it's more important to coordinate, in what stage of the humanitarian assistance or the supply chain function. I think that it would be great if you can tell us a little bit about it.
Yes, and sorry, apologies for not, the Menti is definitely not working this time.
Okay.
But people can write it in the chat.
Yeah. Okay, so as we move on to the to the presentation from Edith. I think that we should pass the floor to Edith without any further ado, so we can start talking about the topic and I'm sure everybody is eager to hear what Edith will share with us today. So the floor is yours, Edith. Thank you.
Thank you very much, Nora. As I said earlier, my name is Edith and I work in Yemen for Relief International. And so most of the things I'm going to speak are in relation to my context in Yemen, trying to relate how coordination has helped or the benefits we have reaped from it and how they have helped us to be able to sustain supply chain in this context. As many of you could know, if you could move to the next slide. I will start with first of all telling about what we are doing in Yemen through Relief International. We have been working in Yemen since 2009, providing health and nutrition support to the Ministry of Health facilities, primary and secondary healthcare in different parts of the country, 6 governorates for now, supporting 40 health facilities, primary healthcare facilities and secondary healthcare facilities. In this case, you will realize that our medical supply chain is very active because we have a lot of procurement to do to support all the services that we provide, which includes child health, curative services, emergency referral, and even prevention and treatment of malnutrition. So in that regard, you'll find we will frequently procure pharmaceuticals, medical consumables, and medical equipment for our programs in Yemen. Next slide, please. So for us to appreciate the coordination in Yemen and what it means to us, is good to understand that context. Yemen is quite a challenging context in the fact that the country is a country in conflict since 2014. And you realize that currently we have one port of entry that is active, which is the port of Aden, which is situated in the south of Yemen. And this means we have 2 factions of government that we have to deal with in the north and in the south, meaning if you procure medical supplies and import them into the country, you will have to clearing processes. You will clear in the port of Aden, and then you will clear to stay in Sana'a if you have to move the items to the north. The road transportation is really challenging because you will need permits to move materials from the south to the north. And at the same time, you will need permits to move materials to the governorates where you work. So that takes quite some time to process, and sometimes the rules keeps changing. So it's a little bit challenging. In Yemen also, we lack a local stringent authority for regulation of medical supplies and pharmaceuticals. In that case, the quality of medicine inside Yemen, we do not have any proof of the level of good distribution practices in the country. Also, the regulations are quite fragile. You realize that the regulations on procurement in and outside the country keeps changing quite frequently. In that regard, the organizations have to keep changing the way they run their processes to be able to comply with the regulations that we get from the authorities. Also, we do not have a centralized medical supply chain system managed by the government. So NGOs get money from the donors and do the procurement individually and distribute to the areas where they work. So in that regard, if we have to have common practices, we have to organize the way to come together and coordinate as NGOs, of course, including the Ministry of Health. So if we could move to the next slide, please. So this slide is why do we think that coordination is important? I know everybody in this call appreciates that coordination at all times is really important, but more importantly, it helps us much in Yemen to be able to support each other to fill the medical supply chain gaps. As I said, we do not have a very strong local market, and at the same time, our international procurement processes are really long because of the clearing processes that I mentioned. And so you find even with the best of planning, you realize that you can run short of medical supplies at some point. And when we coordinate, we are able to help each other to fill gaps. You can borrow from one organization to another. Also, you can realize that sometimes you can have surpluses, and that way you're able to share with other organizations and ensure that we do not end up destroying medical supplies. Also, in this context that is rapidly changing, coordination helps us to come together and compare best practices. For example, if Relief International was able to bring in medicine and there is this new process that they were able to navigate, they can share with other organizations on how they were able to go through that process. And that helps us in a way that we are able to navigate the frequently changing challenges in terms of regulations, in terms of the requirements from the Ministry of Health and other actors, such that we are able to deliver medicine in good time as opposed to when we act individually. Also, we are able to share storage spaces. As you know, Yemen is quite a big country, and as I said, we have two factions of government. And in that case, you realize one organization can have all the resources, including storage capacities in different kinds of governorates. And when we coordinate, we are able to share these kind of spaces. And that means that we reduce the cost of medical supplies that could be caused by the cost that comes with handling of medicine and other supplies. Also, we are able to leverage from each other's strengths. I think we agree that not all NGOs are strong in each and every aspect. You realize some organizations are really strong in supply chains. Some organizations have a way of transporting medical supplies, even with their own planes, with their own temperature-controlled vehicles. And so when we coordinate, we can be able to support each other with this and leverage from each other's strength. Other organizations are really good with negotiating with the Ministry of Health and the government to be able to get access to different areas. And that way we can help each other to acquire access and be able to deliver these supplies to where they're needed most in the last mile. Also, we help each other in ensuring that there is safety of medical supplies. Our context is greatly fragile. And so when we work together, we are able to share information related to how, mainly with road transportation, on how we can be able to achieve to reach to some of these areas that are really hard to reach and do so safely. By that we ensure that we do not lose medicines and other supplies on the way. And that enables us to be able to reach even the hardest to reach areas with the supplies that we need to deliver. Next slide, please. So there are many challenges, of course, that face medical supply chain in Yemen. And of course, as I mentioned, the local market is challenging because of the lack of stringent regulations. And when we do not have any of these stringent regulations, that means a larger percentage of our procurement has to be international. The average lead time you will find is about 6 months to get medicines in country. So these challenges it makes it really hard to have medicines on time, and also to make sure that we do not run short because of the planning that comes with that. We also have a very limited pool of pre-certified local suppliers, and that means there is lack of competition. And when there is lack of competition, the prices are very high. So our budgets for medicine, you find, can be really very high. You realize that an item that you could on a regular day buy for $1 in Yemen, you can end up buying it for $4 or $5. So it is really, really expensive to buy in country because of this limited pool of certified suppliers. We also have very long government-related bureaucracies and clearance processes. And as I said, rules keeps frequently changing. So in that regard, you realize that you can bring medicine from an international market, but again, you realize that they can stay in the clearing port for 2-3 months without you having to being able to clear. There is high cost of storage because of the inconsistencies in power and access to power, where you find that organizations have to have an alternative power supplies, maybe a generator, and you realize that running that is really quite a cost. The condition in Yemen is quite volatile and unpredictable. security situations can change, and hence you can end up having frequent losses of access to the field. And whenever you lose access to the field, that means you cannot be able to deliver the materials even when you have them. And sometimes you can be having materials in one of the field locations and you lose access to it completely. That means in a way you can lose your supplies. There is also very frequent change of health needs that limits our accuracy in estimation of the medicine and supplies that we require, mainly because there are many aggravating factors that disrupt the determinants of health. This could be displacement, disease outbreaks, floods. So all these issues keeps coming up, and they change the health needs that are in country, and also the nature of the health needs, because sometimes you can plan for a disease outbreak and then tomorrow you have a mass displacement or you have mass casualties. So you realize that the needs that you had have changed. So this uncertainty keeps us having to adjust our needs in terms of medical supplies and equipment. Next, please. So I am going to give an example of how organizations have coordinated and how this has helped us to be able to sustain medical supply chain. I know we all agree in this call that coordination is not easy because we are working towards the same goal, but at the same time we have different processes. So bringing people together is not easy, but I know we agree that there are benefits that comes with that. So my first example relates to a local market assessment that was done in Yemen by QAMED. I know we know QAMED is a body of qualified experts who come together to ensure that the quality of medicine through assessments. And for us to be able to do this in Yemen, the initial assessment was done in 2019, which brought together 6 NGOs, which was led by IRC at that time. QAMED did assessment to the local suppliers of medicine and medical supplies in March 17 to 30th, and they were assessing the good distribution practices for these suppliers. Whereas the assessment did not give us so many suppliers who were compliant, because QAMED was recommending suppliers who are above 60% compliance. And we have been referencing to this report mainly when we have restrictions in terms of some donors who require us to procure only from pre-certified suppliers in making decisions on where to procure. This assessment has since expired. If you could move to the next slide, please. And it has a validity of 3 years. And so another assessment was organized. This time, 17 NGOs came together. Relief International is the lead agency for this initiative, and the assessment started on December 10th, 2022, which is this month. We are hoping that we are going to get more local suppliers, and such that we are able to move more our procurement in country without compromising the quality of products that we get. The fact that the previous assessment was done and the small local suppliers have seen the impact of this assessment and pre-certification, MOH, which we reference as MOPHP in Yemen, have also expressed interest in this, which we think is a good thing, because that way they are able to understand the standards of quality and what we require as organizations and why we have to buy from pre-certified suppliers. It is expected that this assessment, once done, we might be in a position to get more suppliers in country, and hence we will be able to procure better and maybe reduce the timelines of our procurement. Someone may ask, how does this have to do with ensuring that we get medicine to the last mile, or what is the benefits of this? And I'm going to explain them in the next slide, if you allow me. So this contributed in improving medical supply chain in different ways. One of the things is improving planning. By knowing that we do not have a lot of local suppliers that we can buy from, organizations were able to plan their procurement better in such a way to know that most of our procurement will be international. The lead time is 6 months, and hence we have to put measures in place to ensure that we are able to cover these gaps. Without this assessment, it would have been very difficult because we would be under impression that we can source locally and internationally. And again, the fact that most these NGOs were involved in this assessment, you realize that when it is more than one organization, it becomes an issue of concern, not just to us as NGOs, but also as the local suppliers. And so we anticipate that when this assessment that is going on will happen, the local suppliers will have improved maybe their practices, and hence we might get better results in terms of how many suppliers we can source from. So by understanding the situation on the ground, NGOs were able to plan better, and that way we reduce the disruption of medical supply chain, even to the health facilities where we support, which is reference to service delivery points. It was also helpful when we came together as NGOs to cost share, because this assessment required funds, and it could not be done, rather it could be done by one NGO, but it is more of a burden than when you have more NGOs coming together. And in that regard, you realize that the cost burden is lower when we are many of us as an organization than when as organizations than when one NGO is doing it. This second assessment, when 17 NGOs came together, the ECHO realized that most of the NGOs that are involved in this assessment are also ECHO partners. And so they decided that they are going to fund this assessment, ECHO as a donor, through Relief International, which will represent all the other NGOs. So without this coming together and increasing the number of partners who are involved in it, maybe this would not have gained the attention it gains from the donor community to enable us to do this assessment. And this cost sharing is really helpful because if one NGO has to pay for it, that means there could be an issue of can we afford it, and maybe we might end up not doing it, and that way it has an impact on the last mile delivery of medical supplies, because we might not end up knowing what kind of a local market we have, or even the planning, as I said, ahead of time to be able to cover the longer lead times internationally, and the same for the mobilization of funding, as I have mentioned. This also helped us to be able to comply with the donor regulations, because many donors require us to procure from pre-certified suppliers. And without this assessment, there was no document that could show that anybody is pre-certified. In that regard, compliance to donor regulations means that we are able to get more funding for medical supplies, without which we couldn't have this document to negotiate for it. And in all ways, our service delivery points are able to get medicine because donors are willing to continue funding this kind of projects. Also, there is improved capacity of the local suppliers, because they know that without good practices, as it was seen in the first assessment, that they are going to lose business. And so there is that urge to make it better in the way they deal with things, in the way they manage supplies, such that in the next assessment, they will be able to attain the required standards. We are therefore hopeful that this initiative will enable us to be able to procure more locally once the assessment is completed. Next slide, please. Yeah, so my second example relates to coordination through the logistics cluster. I know in many emergencies, we have a logistics cluster coming together and supporting partners with in different ways, and of course, bringing partners together to share experiences. In Yemen, this is led by WFP and brings together NGOs. What the logistics cluster through WFP has established storage facilities in Aden. If you remember, you realize that Aden is our port of entry. And so, as I said, that clearing processes sometimes can take a month or two for you to be able to get cleared. And that means these storage spaces helps us to store our materials, pending transportation to the field locations where we work. So what happens is that partners ask for storage space in advance, they share their needs, and WFP is able to allocate this space. WFP is funded directly for this initiative, and so partners do not have to pay more money. However, they have to coordinate with WFP and plan in advance such that the space is available when they need it, and also for the duration that they need it for. At the same time, the nutrition cluster supports with the transportation of materials to the governorates or to the field locations where partners are. In this regard, you realize that partners are at ease because WFP monitors the transportation if requested, and they're able to deliver materials in better conditions than we would do if we were dealing with a private kind of a company to deliver materials to our field locations. So the question would be, how does this help us in terms of ensuring that we deliver the best to the field locations? If you could move to the next slide, please. Yeah, how this coordination supports medical supply chain is that it eliminates the need for NGOs to establish transit storage facilities and hence reduces the cost of shipping. Without these storage facilities, you realize that NGOs would have to establish storage capacities in the Port of Aden because of the longer time it requires for these materials to be cleared. But with this facility from the logistics cluster, you realize that NGOs don't have to do that. They only need to coordinate with WFP to ensure that space is available when they receive materials in country. At the same time, there is the preservation of quality of medicine and medical supplies, because these storages are established with the optimum conditions. And so when the materials are in this warehouse, you're sure that they are within the required kind of storage requirements. And hence you do not keep losing medicine because of storage related kind of situations. At the same time, by providing the road transport, as I said, that our road transport is difficult because you need permits, you need someone to monitor security. And when you transport through the logistics cluster provided facilities, you realize that we are able to deliver materials without much worry and without losing it, because WFP has a way to monitor security and ensure that it is safe to deliver these materials. And also, of course, the NGOs still have to process the permits with the Ministry of Health, but with the WFP monitoring security, at least you're sure that they will be transporting within the required conditions, and at the same time, the materials will be delivered to the destination, most likely without much risk as to when you use a private company. Next, please. So the question here would be, was Yemen impacted by the COVID-related supply chain challenges that came in? And us as Relief International, yes, we were, because of the global supply chain challenges, and we faced a delay of about 2 months to get our materials in country. And during this time, as I said, that when NGOs come together, they are able to help each other to fill in gaps. We reached out to FHI 360 and WHO. And at that time, they had medicine in country. And so they were able to support us to cover gaps within the time that we had faced a delay through a donation. Without this, it would have been very difficult to sustain services. And that means that some of these health facilities would have had to run without very essential medicines. And at the same time, that means that the quality of service provided would have not been optimum. So as I said, coordination benefits us when we come together, because there was no other way for us to know that FHI and WHO can help unless we could have coordinated and they were willing to support us, considering the challenges that all of us face in a country like Yemen. So what I can say is that during this unprecedented kind of a challenge, coordination came through, because we were able to support each other, because we can talk to each other and we can come up in a common agreement that we are all working towards the same purpose. Next, please. So we learned lessons during that time of the pandemic, and I believe many people have learned quite a number of lessons, because this was quite unprecedented. And one of them is that all of us have to ensure that we include contingency funds in our medical supplies budgets during project design, so that we can be able to accommodate the shock that comes in prices when it happens, like the way it happened during COVID-19, because sourcing was really difficult and prices skyrocketed. So that is a lesson we learned. Also, we learned that we ought to maintain an in-country buffer stock such that we are able to cover these challenges. And also when we have medicine in country, like I mentioned earlier, that the WHO and FHI had medicine in country, they were also able to help other organizations to cover gaps. So even if organization could maintain this buffer stock in emergencies, you realize that we can also help each other for those who could be running short due to this kind of situation like a pandemic. We could support each other to cover the gaps. Also, coordination between organizations is of utmost importance because it can help in this kind of a situation to cover gaps and to face challenges that comes with a disruption like what we faced during the pandemic. Next, please. So what are some of the enabling factors that we can use for coordination? Of course, one is the cluster system. You realize that through the cluster, many NGOs come together, and that is where we share lessons and information, and we communicate to each other. So this is a tool that we have to keep and be committed to ensure that we are able to sustain medical supply chain. Also, we can have special task forces where members of the cluster or NGOs that have common challenges related to medical supply chain can come together and find solutions. For example, in a context like Yemen, you realize that we really have a challenge with procurement and of restricted goods like psychotropic medicines and anesthesia. And not all NGOs venture into programs that support that. So those who support those kind of services can come together and find common solutions and even build some kind of synergy to negotiate for access for this kind of medicines and medical supplies. Also, there is online platforms where people can have a group, WhatsApp, Skype, Teams, and you can share information related to medical supply chain and use this as a tool to reach each other. There is also bilateral engagements where an NGO reaches out to another directly, and that way you're able to discuss. For example, if you already know that Relief International has this level of medicines with them and I am lacking on the same, you can just reach out and ask for support. I think this is a tool that we usually use a lot in emergencies. And I think in a context like Yemen and other emergencies, I think NGOs just have to talk to each other and find a solution to the problems that exist. Next, please. There are some takeaways for me. I think the purpose of coordination is to ensure that we reach the last mile and we are able to ensure that people who need medical supplies in whichever part of areas of work, whether it is hard to reach, whether it is a front line, that they are able to get what they need when they need it. So one of the things that we have to carry away with us is that coordination is of utmost importance in medical supply chain, especially in emergencies, because we face challenges that are very peculiar and that are very dynamic. They keep changing. So if we coordinate with each other, we are able to access areas that are difficult to reach and be able to reach that very last mile that we all anticipate, rather we all endeavor to get to. So talking to each other, being able to coordinate amongst ourselves, it's a tool that we cannot ignore in any form of emergencies. We also take away that the cost of medical supply chain can be lowered if we coordinate, mainly because that way we can be able to share common costs, like we can share warehouses, we can share transport facilities, we can be able to share even the medicines that we have or medical supplies that we have. You realize that we can be having surplus and another organization does not have, so we can share. And that way we can lower the cost of supplies rather than the way we can lose money with destroying supplies, mainly because we could not use the surplus. Also, the lack of coordination can pose a major challenge in emergencies, mainly because of mixed messaging. I said that the rules and regulations keep changing, and if one organization is communicating this to the existing authority and another organization is communicating this, navigating access becomes very, very difficult, rather than when you are together. And if you cannot negotiate for access, means you cannot deliver materials anywhere. So coming together is really, really important. and lack of it can really cause a lot of hindrances. Supply chain challenges in emergencies can be addressed better when we are together than when one organization is trying to struggle with it, because coming together creates a lot of synergy that enables us to negotiate and enables us to be able to help each other and leverage from each other's strengths and cover each other's weaknesses. So I do appreciate your time, and I will be happy to take questions, and I'll yield the rest of the time to Nora. Thank you very much.
Thank you, Edith. You know, we are so glad you could share hands-on experience, because it's very clear that all these takeaway messages come from your own experience in the field, and how useful for Yemen and for the beneficiaries of this humanitarian assistance is to coordinate and to reach out to other organizations who are trying to deliver life-saving supplies to the people who need them the most. Many of the participants here agree with you that there are many benefits of coordination, especially in humanitarian assistance. Some of them have said that, as you mentioned it also, that it reduces costs for freight and costs of import, and also to learn how to navigate around the policies and regulation in each country. Also, that it ensures the continuous uninterrupted supply of health commodities with best quality and the right quantity. That, you know, coordination avoids overlap in the implementation of activities, and also it allows the sharing of responsibilities. Coordination reduces the chance of failure, because you can, you know, do synergies with other organizations. Its effectiveness is enhanced through coordination, because you're not alone in the effort to deliver supplies, as you mentioned it. Also makes quick and safe delivery of the products, because if you leverage the expertise from other organizations, the learning process is reduced and you are more effective in delivering those supplies. And also, when you talk about coordination and when it's in what function of the supply chain is more beneficial and effective, someone said that coordination is key across all the supply chain components. So at every step of the supply chain, is very important to coordinate, and even more during emergency responses. So thank you again for sharing all those great insights and experiences, Edith. And we have some questions posed by our participants here. Some of them are related to coordination and some of them are general. So Fabian mentions that in one of your slides, you mentioned the volatility of Yemen. How do you navigate in ensuring commodity security in the country in relation to distribution, Edith?
Yeah, I would say that, of course, that is a challenge, because things keep changing quite rapidly in terms of security. But having humanitarian access teams that monitor the security of different locations, and also, as I said, sharing information across organizations on what is happening where and areas that are really volatile, then that way we have been able to navigate. It is not devoid of risk, but as far as for the last, I have been in Yemen for 4 years, and during this has worked in terms of sharing information and monitoring security through the humanitarian access teams.
Okay, thank you. So when you talk about the local market assessment, did that include only suppliers and not manufacturers?
Yeah, there is very limited manufacturing that happens in Yemen in terms of medical supplies. Most of it is sourced internationally. So this included only the suppliers in country, mainly because the manufacturers are, I think they should be less than 5 or even 2. So they were not included. And also, as I said, the situation changes a lot. So manufacturing in country becomes very difficult as the conflict continues. So suppliers are sourcing more internationally.
Thank you, Edith. I have to mute myself because there was a plane passing by and it was too noisy. Okay, so someone is asking if Yemen has exemption status from the UN. And this person is wondering if you have explored any other options from UN in terms of importation in order to reduce lead times, because you talked about how that there was a delay in receiving some supplies. And so if he's asking if you have explored other options.
Yeah, the challenges with access seems to be affecting all of us across board, including the UN, mainly because the authorities that we negotiate or work with most of the time are not so much tied to international best practices in dealing with humanitarian organizations, including UN. So it is not like this is peculiar for NGO. It also happens to UN, regardless of what status they hold.
Great, thank you. Someone is asking, which platform do you usually use to coordinate with service delivery points? Not with other organizations, but with the service delivery points.
Yeah, I would say this is a challenge, mainly because, as I said, there is no centralized management of medical supply chain in Yemen. And so you realize that coordination across service delivery point has to be managed by NGOs. So each NGO manages differently. You will find some organizations have deployed an electronic system of coordinating among NGOs. Others do not have those capacities. So you realize that coordinating across service delivery points remains a challenge, that it does not have one answer that we can say that it has been completely solved. So it's an opportunity for exploration. But with the changes that happens in Yemen on every day, I am not saying, I cannot certainly say that we will have an answer to this quite soon.
Thank you so much. And who are the main actors in the coordination chain? I think this is a very important question because it's related to how you plan coordination before you need, for example, storage during an emergency and so on. So who are the key actors in this coordination chain based on your experience in Yemen?
Yeah, in Yemen mainly, as I said, it's the NGOs and the UN agencies, of course. The Ministry of Health is not really involved as such in terms of managing medical supply chain, because the funding goes to the NGOs and NGOs directly manage this at different levels. So when it comes to coordination, it's mainly the NGOs and UN agencies. And Ministry of Health most of the time comes in when it comes to getting permits and delivering to different destinations, but not really day-to-day management of medical supply chain. Okay. I hope that answers the question. But so I would say in one answer that the main actors here is the NGOs and the UN agencies.
Okay, and how during when you think about coordination, how do you plan it beforehand? And is setting aside funds to eventually implement the actions that you coordinate important? Because you mentioned, Edith, that okay, sometimes you have used the storage facility from the logistics cluster, but in order to do that, you need to have the funds to cover that. So how do you do that?
Yeah, we must agree that funding is the oil that oils the machine. You know, without funding, you cannot be able to sustain or rather to run any of these facilities. So sometimes the funding can be like what I said, NGOs come together and contribute, or donors come together and fund one organization. Specifically for the logistics cluster, storage and transportation facilities, you find that WFP receives this funding and provides partners with these spaces upon request. So planning and having it funded is the first thing that you have to do for any organization if you have to keep supply chain going, and also if you have to coordinate for any form of facilities.
Okay, thank you so much. And when you talk about coordination in warehousing and distribution, you mentioned what actions you have taken, but what about forecasting and quantification of health commodities? Do NGOs come together to do that, especially if you're working in the same geographic area?
Actually, I would say no, this is not working very well, mainly because we have very different funding calendars, and the funding for Yemen is very, very fragmented. So you realize that being able to synchronize and come together and say, this is the money that I've been given for this kind of support, and so we are going to synchronize it like this together, is challenging. Also, the administrative processes of different NGOs are different. But recently, I think there is an initiative going on through BHA that they want to bring together the needs of partners and have this managed by WHO, but that has not materialized thus far.
Thank you, Edith. So we're almost to the end of this technical discussion. Before we close, we would like to share some ideas for action. During the presentation, Edith mentioned many times the importance of knowing who you are working with, the communication with other NGOs. So it's very important to map the organizations working in the same geographic area and learn about their capacity and infrastructure to deliver supplies to the last mile. When it comes to coordination, it's important to know who is working where and what capacity other organizations have so that you can partner with them. Establish regular communication with local suppliers and other organizations managing similar health products to build this relationship and be prepared for eventual information and product sharing to mitigate any potential product delivery crisis. And also promote information sharing across the communities that receive humanitarian assistance, as they can provide the connection between among humanitarian organizations and facilitate coordination efforts that will benefit the community as a whole. So I think, thank you so much, Edith, for sharing all this knowledge. And I hope that for all the participants who join us today, this was a very beneficial and interesting technical discussion. And I don't know, Annabella, is Nadia still with us? Because this is our last education series event of the year. And we would like Nadia Olson to close this session, if she's still with us.
I think she is.
Annabella, Nadia?
Hello, everyone. Thank you so much for attending, especially those of you who have come to all of the sessions. My name is Nadia Olson, and I'm the Humanitarian and Fragile Setting Lead at JSI. And I help to manage this project. And I'm just very excited to see the level of participation we've gotten at these sessions, the rich technical discussions, the back and forth with the active questions. And we've been challenged by others who are involved with this project to do some work to look through the themes and share them back with the community that are coming up over and over again in these presentations. And so we'll be doing that in the future. And we really appreciate your participation. Thank you so much to everyone.
Thank you, Nadia, and thank you, Barbara. Barbara, you probably, all of you know Barbara Lamphere, who has been instrumental in strengthening the capacity of many participants. And so thank you, Barbara, for being with us always and supporting our technical discussions and for teaching us, not only the participants, but your colleagues, teaching us so many lessons in supply chain.
My pleasure. And best wishes to everybody for the new year.
Thank you, Barbara. So best wishes, happy Merry Christmas for those who celebrate this celebration. And remember that we also have some resources that we want to share that will be listed in this PowerPoint presentation when you receive it. And so we wish you a wonderful end of the year and wish you all a very successful and healthy 2023. It's unbelievable that this year is over, but we look forward to a bright and happy new 2023 year. So bye for now, everyone, and hope to see you at the beginning of next year. Take care. Thank
Happy
you.
New Year. Yes. Bye-bye.
Bye-bye.